art, and medical imaging, have a long relationship, one that began to blossom during the time of Da Vinci's Vitruvian Man, around the year 1490. Da Vinci's dark of night dissections, and his remarkable empirical studies resulting in hundreds of anatomical drawings, formed the basis for the modern methods of anatomy. These methods truly began to bear fruit with the efforts of Andreas Vesalius, who, unlike Da Vinci just half a century earlier, was free from the restraints of the Church and lawfully permitted to conduct his medically contextualized study of the human body. In 1543 he wrote and published, On the Fabric of the Human Body, a set of books on human anatomy which became the standard text for the art and science of medicine and anatomy over the next few centuries. Moreover, it linked the mediated image of the body from the realm of the visual arts to the realm of the medical arts, a blending of the arts that is not yet separated in the oils and waters of technology. As importantly, it began the process of bringing anatomical and physiological information into the public sphere and common knowledge. But in 1895, everything changed for medical imaging. No longer was the pen and charcoal the medium of choice. A convergence of new technologies forever changed the way we look at medical images. The combination of the discovery of X-rays by Röntgen, the development of film, and the beginnings of mass media brought about the ideal conditions to bring the deepest and the most intimate parts of our inner bodies into the mainstream media and the public gaze, as well as advanced medicine and the treatment of patients. And from Röntgen's initial discovery would spring a revolution of the mechanical medical eye that has yet to reach its zenith, and is continuing to produce images that both astound and mesmerize, yet are largely produced not with the public in mind, but rather for the health benefit of individuals. Having established the historical position of the medical image as a visual medium born of scientific advancements for the purpose of complementing the medical arts, it is time to look at whether the art of medical imaging is in the making of the image, or in the image itself. Sadhu Panda, editor of the Journal of Community Medicine, attempted to delve into how to define art in medicine in his 2006 article titled Medicine, Science or Art? To begin to answer the question posed, Panda quotes Steve Solomon, an office director with the Center for Disease Control. Medicine is supposed to be a scientific study and its practice an art. The study of disease requires the aid of science. Consummate art is required to effect a cure when nature is no longer able to help herself. Panda continues to build his argument by crediting Cecil's Textbook of Medicine by Goldman and Dennis, 2004, with the notion that the art of caring and comfort, guided by millennia of common sense as well as a more recent systematic approach to medicine, remains the cornerstone of medicine. Without these humanistic qualities, the application of the modern science of medicine is suboptimal. Certainly, the medical image maker is not a doctor. However, there are skills shared by both professions that represent the art of medicine. What X-ray technologist has not had to comfort the trauma patient? What CT technologist has not had to explain the basics of radiation dose to a fearful patient? And what MRI technologist has not had to talk a claustrophobic patient through the exam? It is in these skills, in conjunction with the more practical skills based in science, those of observing and understanding the anatomy and physiology which guide our positioning and technique selections, that fully demonstrate the art of medical image making. So it is that the argument comes back to the humanities. the arts, regardless of the cornerstone of science that medicine is founded upon. It may be fitting at this point to continue with Goldman and Dennis. The art of tending to the sick is as old as humanity itself. Compared with its long and generally distinguished history of caring and comforting, the scientific basis of medicine is remarkably recent. Further, the healthcare provider is advised to understand the patient as a person. 3 fundamental principles are important to practitioners. They are primacy of patient welfare, patient autonomy, and social justice. This may be the most valuable point in practicing the art of medical imaging. No matter how busy the cast clinic is, no matter how swamped the CT department is with emergency patients, the patient we are with, in the moment, has come to you for help. They have arrived with their own concerns and worries, and it is every bit as important to their well-being that they are treated with respect and kindness, as it is to get a good radiograph or scan. Who can deny the beauty and elegance of some medical images? Indeed, many in this room were lured here by them, whether they had seen their own images in a doctor's office, or had seen some on a TV documentary, or in movies, or even advertising. There has been a promiscuous history of medical images in the media from the inception of X-rays. Not only was Röntgen's radiograph of his wife's hand printed in newspapers around the globe, but soon after women were going to studios to have like images made, to give to their husbands as the most intimate photo imaginable. In fact, there were numerous X-ray studios where one could have their portrait made, at least until the dangers of radiation were properly acknowledged, after which time X-rays were largely the province of medicine. However, in the information age there is a return to use of the medical image out of its context. In its own way, the digital age has allowed the return of the freak show, that has been shunned since the 1950s. Instead of going to the carnival, one only needs to go online, or tune in some TV show with a title that promises the bizarre. In the digital age, there is no longer sanctity in any image. And behind these compelling images, often there are ethical conundrums about an individual's health. Personal, intimate, medical images of all manner are now posted for anyone with an internet connection to see. The only thing we can sometimes arrange is the momentary context of how the image is viewed. If we are in our doctor's office, and being shown the CT scan that confirms we have lung cancer, it is a very different experience than seeing a similar image on a pack of cigarettes on the dashboard of our friend's car. In his 2005 book, Mediated Bodies and the Ideal of Transparency, which explores the assimilation of medical images into the public gaze, Jose Van Dyke writes, X-ray pictures, like other mechanical reproductions, always yield mediated perspectives, as their meanings are always shaped by the knowledge and feelings of their interpreters. Thus, the door is open for all manner of interpretations of the medical image, not all of which are beneficial. Van Dyke continues, in a culture that increasingly concedes private grounds to public cameras, medical ethical issues are media ethical concerns as well. The ethics of representation, therefore, are part and parcel of the aesthetics of display. Aesthetically appealing images fascinating large crowds tend to override legitimate questions of ethical permissibility and educational value. Further, it is Van Dyke's position that the casualization of high-technology imagery creates issues that extend beyond the images, and focuses on imaging technologies. This being a belief that seeing is curing. Which is to say, to the layperson, it seems a small step to go from seeing a pathology, to doling out a cure, and that the more advanced the technology becomes, the easier it will be to treat people with even the most grievous pathologies. If there is hope of redemption for the medical image in the digital forum, it may be through the one lens that is capable of raising questions nearly as important as the questions medical images set out to answer: the point of view of the visual arts. Through the visual arts, medical images have been, and can be used to question myriad subjects, not the least of which are the notion of body as object or subject, life and death, and the place of medicine in our culture. The very same questions which seem to have been unwittingly asked by the careless, or some would say natural, act of releasing the medical image into the public realm in the first place.